They've already started working on it, developing very rapidly a vaccine for the virus to combat the virus.
In early 2020, scientists around the world began racing to develop vaccines to protect people from the new COVID-19 virus. But even with widely available vaccines just on the horizon, trust in the vaccine is fairly low.
I'm not interested. I'm waiting to see other vaccines come out.
Safe and effective vaccines are proven to reduce deaths and help end pandemics. So why are people unwilling to take them? And how do you build trust in a vaccine we may not know everything about yet? Vaccines for COVID-19 have been developed faster than any vaccine in history.
We don't usually have 180 research labs across the world doing it. We don't have 100 companies across the world doing it. We don't devote $24 billion to doing that. That's the difference.
The usual expectation is it's about 8 to 10 years to do this. But people are dying, and we needed to do this at unprecedented speed.
Previously, the vaccine that had been developed the fastest was for mumps, which took 4 years and was approved for licensing in 1967.
We have a whole new suite of new technologies and opportunities we haven't used in previous times. From a scientific or political point of view, it's an achievement. But from a public point of view, it's like, whoa, that's way too fast.
We're still seeing some hesitancy about the vaccines, taking the vaccine, even from healthcare workers.
That's the reason why we've got to continue to get that message out, that the process by which the vaccines were made were a standard process that was rapid because of exquisite scientific advances.
I think a lot of people are troubled about the way in which this particular year, with our country so divided, this whole process of developing vaccines, like everything else, has taken on political overtones.
The COVID vaccine is not only a new vaccine, it's a brand new virus we're learning about every day. These vaccines are made in ways that no other vaccine has been made.
A lot of the polls suggest as many as half Americans may say, I'm pretty skeptical, I'm not sure I want this. Resistance to vaccines goes back a long way. It didn't just happen in the last 20 years or the last 2 months.
In 2019, the World Health Organization ranked vaccine hesitancy as one of the top 10 threats to global health.
New vaccines are the most vulnerable to hesitation, doubt, questions.
Only a small majority of Americans said they would take vaccines introduced during the last 4 pandemics.
It's seeming to take shortcuts, being too quick. In the 2009 H1N1 pandemic, that was one of the biggest reasons for people not taking that vaccine. And that was a much more familiar vaccine. I mean, that was based on your more typical seasonal flu vaccine.
Unless you get to the point where 70, 80, maybe 85% of the population is immune, the virus still has plenty of people that it can attack, who can then spread it to other people who are not immunized. And so it goes on and on.
Vaccines have helped put a stop to past epidemics, like polio, measles, and smallpox. When a safe and effective polio vaccine was introduced in 1955, cases dropped by nearly half in just a year.
When the polio vaccine was developed, this was a moment of national celebration. You couldn't be alive in 1953 or 54 without being worried about what this might mean for your family.
There are many factors that have really changed over the course of the past 40, 50 years since we've seen that polio vaccine. Technology has changed, how we deliver healthcare has changed. So much has changed in general around how folks are receiving news.
Confidence in vaccines has eroded over time. Just in the last 20 years, the number of Americans that believe that it's important for their children to be vaccinated has dropped from 94% to 84%. While there are groups that are ideologically opposed to vaccines, there's a much larger portion of people who are just nervous about them.
We are in an era now where patients are extremely informed and they are taking control of their own healthcare. And that means that they want to see the data themselves. They want to be able to do their own research.
Things like misinformation, political climate, and bad personal experiences can all contribute to vaccine hesitancy. The number one concern when it comes to vaccines are potential severe side effects.
Yes, people do get sore arms. Many of us who've had a flu vaccine will know sometimes your arm hurts the next day. Some people have had low-grade fever. That certainly happens with other vaccines as well.
When your immune system is challenged with either a natural virus or with, in this case, a vaccine, it revs up. The immune system needs a better public relations team because we always call them adverse events or serious side effects when it's really just your immune system doing what it always does.
We don't know if there might be a rare person who, after having this vaccine, had some other long-term consequence that didn't appear in a 2-month period. But we know from other vaccines, that's the window where if some trouble is going to happen, it usually does. And you got to balance that against the chance of dying from this disease if you're not immune.
But building confidence in vaccines, especially during a pandemic, can be difficult.
I mean, if you ask me the question, would I take a COVID-19 vaccine right now? I would say, let me see the data. And I think once I see that, and I see that, for example, my age is represented in these trials, and were I an African American, or were I, a member of the Latinx community, or if I had diabetes or I was overweight, I want to make sure that I am represented in all these trials so that I can feel comfortable getting the vaccine. And then and only then would I get it.
Advertising and education campaigns can help get data out to a wide audience.
I want you to know that vaccines are safe, effective, and they keep your child and your entire community healthy.
But trusted community members and leaders may be the best tool for building confidence in vaccines.
In the distant past, you would have celebrities get vaccines, like Elvis Presley gets the polio vaccine.
Find the right people in the community who can turn to their peers and say, what are your questions? Sometimes it's a school teacher, sometimes it's a religious leader.
I particularly think this is going to be important in communities that have traditionally been distrustful of medical research for sometimes good reasons, like African Americans who all remember Tuskegee, or Latinos who aren't always sure that our healthcare system is well designed for them. They need to hear from doctors who are part of their community.
The best thing a doctor or a nurse or a pharmacist can say to a patient to help them feel confident in the vaccine is that I got it too. I was also vaccinated and I'm okay.
For COVID-19, additional factors like wanting to get back to normal life could also help motivate people to be vaccinated.
You may be able to go back to work. You may be able to get on an airplane or go to a sporting event or a concert.
I mean, I think as the vaccine gets out there and people feel more comfortable about it being safe and you're starting to see the numbers go down, I'd like to think people will get more and more comfortable about getting the vaccine.